Podcast 9 of the Abdomen series, the Posterior Abdominal Wall. This podcast is going to detail the posterior abdominal wall and describe its muscles, the lumbar vertebra, and the associated nerves and vessels. So the posterior abdominal wall is composed of the 5 lumbar vertebrae in the midline, a series of bilaterally paired posterior abdominal wall muscles, and varying amounts of fat that surround the aorta and inferior vena cava, the kidneys and ureters, and numerous somatic nerves. The 5 lumbar vertebrae, L1 to L5, project into the abdominal cavity and form 2 paravertebral gutters either side of the midline, and these gutters are where the kidneys and surrounding renal fat are located. The lumbar vertebrae are different to the vertebrae found in the thoracic parts of the vertebral column, as they have a much larger, kidney-shaped vertebral body, and this is necessary for the increased weight bearing required by the inferior parts of the vertebral column. The vertebral foramen, containing the spinal cord and meninges, is triangular shaped, and the transverse processes are long and slender. Like the thoracic, the lumbar vertebrae also contain a pair of superior and inferior articular facets, allowing them to join to superior and inferiorly corresponding vertebrae. Their spinous processes project posteriorly and are shorter and broader than those observed on the thoracic vertebrae. The first lumbar vertebra articulates with the 12 thoracic vertebrae superiorly, and the 5th lumbar vertebra, which is the largest, articulates with the base of the sacrum, which is formed by the superior surface of the S1 vertebra. Each side of the lumbar vertebrae are the bilaterally paired posterior abdominal wall muscles. These are psoas major and minor, iliacus, and quadratus lumborum. These muscles are involved in moving the thigh and vertebral column. Psoas major is a long, thick muscle that is found immediately lateral to the lumbar vertebrae, extending from the transverse processes of L1 to 5 to the lesser trochanter of the femur by passing deep to the inguinal ligament. In the butchers, this muscle is referred to as tenderloin in the pig and fillet steak in cattle. As psoas major extends deep to the inguinal ligament, it is joined by the tendon of iliacus, and this muscle originates from the iliac fossa of the iliac bone, and these 2 muscles work together in flexing the femur at the hip joint. The joining of these 2 muscles forms the iliopsoas muscle. Quadratus lumborum is a quadrilateral shaped muscle that forms most of the posterior abdominal wall as a flat sheet. It extends from the transverse processes of the lumbar vertebra to the iliac crest of the iliac bone. The final muscle I just want to mention is psoas minor. This is a thin muscle found in about half the population, and it sits on the anterior surface of psoas major and extends from the 12th thoracic vertebra and the 1st lumbar vertebra to the pubic bone. Positioned anterior to these muscles are a series of somatic nerves. There is the subcostal nerve, the iliohypogastric nerve, the ilioinguinal nerve, the genitofemoral nerve, and the femoral and obturator nerves. The subcostal nerve is the 12th thoracic spinal nerve, and this runs infralaterally across quadratus lumborum to pass in between the transverse abdominis and internal oblique muscle layers. Emerging inferior to the subcostal nerve is the anterior rami of the L1 spinal nerve, and this rami usually divides into 2 branches on the anterior surface of quadratus lumbum. It divides into the iliohypogastric nerve superiorly and the ilioinguinal nerve inferiorly. Both of these nerves go on to supply the muscles in the inguinal and pubic regions. The genitofemoral nerve emerges from the L1 to 2 level and travels inferiorly alongside the anterior surface of the psoas major muscle. As it approaches the inguinal region, it divides into the femoral and genital branches, which supply parts of the skin covering the anterior thigh and external genitalia. I'll detail this nerve in more detail in the pelvis and perineum series. The final 2 nerves I'll detail briefly and these are the femoral and obturator nerves, and I'll detail these in future podcasts detailing the lower limb and the pelvis. But for now, both of these nerves are found low down on the posterior abdominal wall, emerging as the L2 to 4 anterior rami. The femoral nerve passes deep to the inguinal ligament to supply iliacus and the muscles of the anterior thigh. The obturator nerve passes into the pelvis and enters the medial compartment of the leg by penetrating the obturator foramen. But as I said, I'll detail these nerves in a lot more detail in later podcasts. So to finish, I want to mention the two main vessels that run alongside the posterior abdominal wall, the aorta and the inferior vena cava. Now the aorta, as I've detailed on many occasions, is the main artery of the body. Within the abdomen, it is about 13 centimetres long and descends in the midline against the lumbar vertebra. It enters the abdomen through the aortic hiatus of the diaphragm at T12 and bifurcates into the two common iliac arteries at the level of the L4 to 5 intervertebral disc. These common iliac arteries travel infralaterally and themselves bifurcate into the internal iliac that supplies the pelvis and perineum, and the external iliac that supplies the lower limb. As the aorta passes through the abdomen, it gives off branches in three planes: unpaired arteries that extend anteriorly, a set of paired arteries that extend laterally, and a further set of paired arteries that extend posterolaterally. The midline, unpaired arteries are the celiac trunk at T12, the superior mesenteric artery at L1, and the inferior mesenteric artery at L3. The laterally projecting paired arteries are the suprarenal artery, which originates at the level of L1. Also originating from L1 are the paired renal arteries, and coming from L2 are the gonadal arteries. The posterolaterally projecting paired arteries are the subcostal, inferior phrenic, and lumbar arteries. Running to the right of the aorta through the abdomen is the inferior vena cava, and this is formed by the union of two common iliac veins. It then ascends towards the right atrium, passing through the caval opening of the diaphragm at the level of the 8th thoracic vertebrae. Along its course, it receives all the venous blood from the posterior abdominal wall, the kidneys via the renal veins, the suprarenal glands via the suprarenal veins, and the gastrointestinal tract via the hepatic veins. The venous blood from the right gonad drains directly into the inferior vena cava, whilst venous blood from the left gonad drains into the left renal vein. So in this short podcast, I've detailed the posterior abdominal wall, detailing its muscles, the lumbar vertebra, and the associated nerves and vessels. In the next podcast, number 10, I will detail the kidneys, ureters, and suprarenal glands.